Some of the buzzwords in Springfield this year, job creation, business climate, but spending, and also cutting spending and runaway spending. One of the things that have happened over the last decade is we had a massive expansion in the eligibility for certain Medicaid programs. And we're back with Jil Tracy, Representative Tracy from the Adams County, Brown County area. And one of the bills that you talked about last year and you worked a lot on the Medicaid reform process was the expansion of All Kids and how to limit that. Can you explain what the All Kids program is, what it was intended to do, and what's it become?
Well, one of the programs that Governor Blagojevich started was the All Kids program, and that would be that kids that weren't eligible for public aid would be able to avail themselves of the All Kids program. At its inception, there was never an income cap on it. Irregardless of a parent's income, the children could be placed in an All Kids program. And in fact, it was costing $7 million a year for just the kids over 300% of the poverty level, which would be about a family of 4 making $70,000 could avail themselves of All Kids and pay premiums, but they were very modest premiums, and there was no income cap.
And so to put that in perspective, when my first year, which was right close to the time when you came in, was George Ryan's last year, the eligibility requirements for some of his insurance programs that hit the certain populations was 40% of the poverty level. So to be eligible for an equivalent program or something like that, it was 40% of the poverty level. You're saying that when Blagojevich came in, he expanded it to...
Well, he just created All Kids program. It was never appropriated through the General Assembly. And it was a very expensive program, and it still is. But nevertheless, we did Medicaid reform back in January of 2011. And the All Kids eligibility was rolled back to what my bill had been to, in that it's 300% of the poverty level, which is about $66,000 per year for a family of 4.
Okay.
Now, what my bill also did was say that if a parent or a guardian could avail themselves of affordable health insurance through their employer, then they could not be eligible for the All Kids insurance program. Because what I have seen is that parents will find that the premiums are cheaper for the All Kids, right, try to avail themselves of that. We've created a false illusion that it's good insurance, and then they could have gotten it through their employer, but it was more expensive. And then they run into problems because of the state's late payment system. Doctors do not like taking All Kids insurance, and often they won't take it. So they had a false illusion that they had good insurance for their children, and in fact they didn't. It was state-subsidized insurance when they could have gotten their own private insurance.
And one of the challenges that we face all the time, if you happen to tend to be more of a fiscal conservative, is people tend to look at you and say, well, you're against this program, or you don't like that program, and they tend to put a mean face on being a fiscal conservative. I would argue, and I think your point, we've talked about this many times, is you want to make sure that the dollars get to the needy people, the intended people, and in this environment we don't have room for waste, and so limiting those parameters of who is eligible does exactly that.
Right.
And one of the ways to cut spending, one of the ways to shrink these programs, is to make sure that we're only helping those who really need the help. We can't afford to live in a climate or have a system which allows us to waste.
Our programs are not working for anybody because the state's not paying its bills on time, and because they don't have the money. We've just expanded and overspent, and it's not there anymore. So we need to roll back eligibility in many of these programs, help the neediest, and make sure there's no abuse or duplicative services.
And I think that's important for people to understand is a lot of folks are, we are not saying, and you are not saying, eliminate the program. You're saying roll back to help those who it was intended to originally help, to those that really need the help, because we can't afford some of the luxuries on the higher end of this program.
Right, and to my colleagues who favor helping, the broader eligibility and the like, my argument to them to try to get my bill through is that, look, these programs aren't working for anyone right now.
Correct.
The most neediest are really suffering. The people who could prioritize within their family budget, pay the more expensive health insurance premium, let's move them off of that state-subsidized insurance and make the program work better for those that need it most.
Okay. Well, Jill, thanks for coming in.
You're welcome. Thank you.